All right, welcome back, folks. You know, a lot of us this whole time were just saying, I don't think this is right. And that's exactly what my next guest said about COVID. He had a lot of questions, and he was demonized for it. Joining me now, the author of The Courage to Face COVID-19, Dr. Peter McCullough. Doctor, appreciate you being here.
Thank you.
All right. So there's a lot of things coming into question now. Recently, there was a case study in Spain where they studied schools that masked versus schools that didn't. And they overwhelmingly concluded that masks had absolutely no impact on stopping transmission of COVID-19 kids. Why were they shutting down our schools?
You know, we had erratic but yet dictatorial messaging coming out of the CDC and our NIH NIAID director about masking. It was up and down. There were 12 studies in public masking, 2 randomized trials, and then this case study you mentioned, all of which showed the masks did not prevent spread of the infection. What really worked, Americans didn't hear about, was virucidal nasal washes and gargles. So dilute povidone iodine, dilute hydrogen peroxide in 12 studies, 3 large trials did work, and they didn't tell Americans about it.
Yeah, and the bigger problem, too, is here Dr. Fauci actually said, I mean, take a look at this. Dr. Fauci actually knew that these draconian, it says Fauci admits he knew draconian lockdowns would have collateral negative consequences on school children. He knew it, and they did it anyway. I mean, what was the medical basis for this, and why does this guy still have a medical license?
There was no medical basis. 2 papers, one large one from China by Cao, and then one published in JAMA by Madewell, showed there was no asymptomatic spread, Carl. It didn't happen. There was no need for lockdowns. Locking down people without the illness was disastrous. And now we hear this admission about collateral damage, ruining people's business, people's education, their future careers ruined by these disastrous policies.
Yeah, and not to mention, I mean, you have an entire generation of kids that, you know, forewent college scholarships because they didn't have athletic seasons and they couldn't be the state champ that they had trained so hard for. You see right there, they got these stupid plastic dividers treating our kids like they're at the DMV. Recently, President Biden came out and he said, look, COVID's over. The media, the White House, everybody rushed it. It's not over. We still need this emergency declaration for, you know, student loan forgiveness, lockdowns, maybe the next election. I mean, is it over or is it not?
The emergency has been over in terms of hospital capacity overruns. That's been over since January of 2021. The pandemic, the viral illness still exists, Carl, but, you know, we're down to about 500 deaths per day, and we know 10% of those are actually due to the virus. The 90% are due to other things. There's more deaths per day due to fentanyl overdoses than there is COVID-19, and we have treatment approaches for this at home. So the pandemic and the virus, it's winnowing down. At this point in time, we clearly can drop the emergency use authorization, go back to normal.
Now, you mentioned a couple things, and that was we took a lot of preventative measures, okay, none of which were really based in science, as you mentioned, but there was a lot of therapeutics, and that was never the focus of any of the doctors. Why do you think they focus so much on the preventatives and even the vaccine, but not things that actually work like ivermectin and things like that?
I think doctors were initially driven out of fear that they didn't, you know, they were comforted by the idea that they don't need to treat the virus. They could wait for a vaccine. And then ultimately major medical groups, the CDC, NIH, FDA, American Medical Association, they demonized treatment and at the same time over-promoted the vaccine. We never took a balanced approach. It was a disaster.
Yeah, no, it really was. Doctor, I want you to take a look at this. Listen to this right here. Oh, we don't have it yet. But before we go to that, we've had a global response. And places like some of the Nordic countries, they largely didn't do any of these things. And even early on, we knew that they were having an initial surge but not, of cases, but not death. Why didn't the focus go to living with COVID rather than just shutting down everything?
Yeah, it was a mistake to take this COVID zero policy. This wasn't like any illness where it was going to get down to 0 cases. We should have adopted a COVID inevitable policy. You know, we had the Great Barrington Declaration that was published in 2020. And this basically was a guideline for America that said, listen, let's not close down, just protect our seniors, take some special measures there. If we had a safe and effective vaccine, it could be used in that limited senior citizen health worker group. and we could have gotten through the pandemic much more rationally.
Right. And I think, Biden, I dare I say, Biden's rationale is actually a glimmer of sobriety within the rest of his presidency. Take a listen to what he said about the pandemic.
Is the pandemic over?
The pandemic is over. We still have a problem with COVID. We're still doing a lot of work on it. But the pandemic is over.
What's the work he's talking about? We're still doing a lot of work on it.
What the idea is we still have residual cases. There are research programs that are finishing up. We do have ultimately, work ahead of us. Obviously, more patients, do come in and get sick with the virus. The virus can infect people now a second and third time, but it's basically become like a common cold. And at this point in time, the government, in my view, doesn't have any more work. This is in my area. It's in the area of medicine. Doctors can handle it from this point in time. Government needs to back out and worry about inflation and other big issues in front of it.
All right. Well, Dr. Peter McCullough, few people know more about this than you do. We appreciate you joining us, sir.
Thank you.
All right, folks. Don't go anywhere. We'll be back in a minute.